This topic is on Klinefelter syndrome. Now, let us think what genetic conditions come to your mind when you see a tall man. Some of the differential diagnoses include Marfan syndrome, Fragile X, Kallmann syndrome, and Klinefelter syndrome, which is the topic for this session. Now, as the name says, there is an extra X chromosome. So the total number of chromosomes in Klinefelter syndrome is 47XXY, or sometimes even more X's. For example, 48XXXY. This is a very common genetic condition. In neonatal period, babies with this condition would have a low muscle tone, a small phallus like micropenis, and undescended testes, sometimes even other genital abnormalities like hypospadias. When they grow older, these are tall boys with long limbs. They develop gynecomastia. Many of them develop gynecomastia. They have learning problems and behavioral problems. Now, the more the number of extra X chromosomes, the more severe would be learning difficulties and other manifestations of this syndrome. As adults, they have small-sized testes, almost always less than 4 milliliters in size, and they are infertile. They have central hypogonadism, which is hypogonadotropic hypogonadism, which means they have elevated FSH and LH but low testosterone. There is slight increased risk in osteoporosis and breast cancer. The risk isn't as high as in women. Some individuals may require testosterone supplement in the teenage years to induce pubertal changes and to prevent osteoporosis.